I'm going to talk about how people make the decision to pursue curative therapies. First, I just have to give this disclaimer, and the views are my own and not that of my employer. So as Dr. Dubon said, the results that I'm going to talk about today come from my own research, as well as from a study that was done with by my advisor and some of her colleagues at the NIH. And they published that in 2020, and they interviewed people living with sickle cell disease who either decided to enroll or decline to enroll in high-risk clinical research. And then the second study is my own dissertation study. In that, I'm interviewing people living with sickle cell disease, as well as providers and scientists in that space. And I also was lucky enough to spend some time in different research institutions where these first-in-human clinical trials are happening. So everything moving forward are going to be the words of individuals that we spoke to, but for confidentiality purposes, all of their names have been changed. So Dr. Shea did a great job sort of going into the clinical aspects and indications for pursuing curative therapies. And so I just want to sort of right now highlight two different ways in which we can think about the sickle cell disease context. And so the first way is, obviously the most obvious way. People have a very intense physical experience that comes out of the variant for sickle cell. And so like Dr. Shea said, these are painful crises, fatigue, and organ complications. And as he was highlighting in his last slide, individual prognosis really does matter as you make these decisions, because people's illness can vary from being mild to moderate to severe. I also, though, want to highlight that part of the sickle cell disease context is very social. And so individuals report various psychosocial stressors and mental health issues like anxiety and depression that emerge from the pain that they experience. And finally, we know that sickle cell is often racialized, which means that it's often incorrectly described as a quote unquote Black disease. And this racialization can cause negative clinical encounters with people reporting negative and racist behaviors when they seek care. People, for example, report being called drug seekers, frequent flyers, and overall disbelief in their pain and symptoms. And so the reason I want to set this context is because both of these clinical and social experiences help us understand how people make the decision to pursue or not to pursue curative therapies. And so on this grid here, like I just said, I want to focus on both the clinical and the social experiences because they are so important to the lived experience of sickle cell disease. And so first, I want to talk about the clinical reasons that people may pursue curative therapies. And I'm in the rest of the slides, there's going to be more patient voice, and I'm excited for our further panels to hear other individuals talk more about this. And so I'm going to share direct quotes from these individuals. And so on the clinical side, we can think about the severity of the disease, as Dr. Shea said. Is it mild? Is it moderate? Is it severe? But we also need to think about the risks and the benefits that a person might have to take when they choose to undergo these therapies. So a person might think about how severe their disease is today versus the complications that they might get in a transplant. Finally, an individual might be predicting their future health, and the way in which they perceive their future health and future prognosis will be really important to how they make the decision. On the social side, what motivates to pursue or not to pursue cure, we can also think about it in three different categories. So for example, we can think about functional elements, and these are things that are like school, work, maintaining interpersonal relationships, wherever or how much your sickle cell may be like impacting your ability to go to school. This is all falling into the functional element side. And then we can think about these clinical encounters and healthcare experiences I talked about on the previous slide. So how often are you maybe having these negative clinical encounters? How often are you going to see your physician and maybe that's causing stress or being hospitalized, things like that. And then finally, a lot of people talked about future hope. And so their hopes of where they wanted to see the technology go. And that was very intrinsic in how they made their decisions. So with that overview, I want to start by talking about disease severity. So how a person weighs at a point in time whether they feel like their disease necessitates a curative therapy. So here's a quote from a participant who felt that there was no other option for them. So Kyle said, "To be honest with you, what other options are there? You understand? Like people who are desperate leap to the first data they see. I've tried it all. I've tried living with sickle cell. It wasn't working for me." And when Kyle said this, he was pre-gene therapy, but had decided to enroll in the trial. Another participant who declined to participate in a curative trial said, and the part that I'm about to start reading is not here, but this is the end of it. So this woman, Paige, said, "Obviously, if you risk something, it's because you're expecting a good result. And in case it doesn't get a good result, you're prepared to the outcome. But my current situation wasn't as bad as others. Because even though I have the liver problem and the pain that I'm living with, I still consider that I'm not one of the patients that are really between life and death, that because they have to go with that research, because that's the last resort they have." And so what this shows us is that clinically for some people, they make the decision based on whether or not they feel clinically desperate. Clinically desperate could mean no other therapies are working for them, or that they are tired of engaging with those therapies. Another way we can think about the clinical elements that are factored into the decision-making processes are clinical risks and benefits. And so, like I said earlier, risks and benefits might look like weighing your current therapy risks versus the ones that you might undergo in a curative therapy. And so, for example, Carletta, a woman living with sickle cell disease, she said, "I'm going to live or I'm going to die. These are the only two choices I have. And when I get a bone marrow transplant, I'm either going to survive it, I will live, or I will die." So Carletta understood that one of the risks of transplantation could be mortality, but she felt that premature mortality was already part of her life because her illness was so severe. On the other hand, for some participants, the clinical risk of the current therapy may be lower than the clinical risk of pursuing a curative therapy. And so I think there was maybe a question in the chat or a comment in the chat about apheresis or chronic blood exchange transfusions. And so apheresis is a type of blood transfusion where an individual's red blood cells are exchanged for most of the time on a 1-to-1 ratio with the donor cells. And this is something that Charles went through since he was, I believe he said, like 5 years old. And he said that because of this, my vitals have been really stable for the last 10 years or so, but having the stability of apheresis is nice. And so for him, he felt that it was not right for him to pursue a new curative therapy that had more risks than his current therapy because that was stable. And for him, his mentality, I guess we can think of it as like, if it's not broken, don't fix it. And so again, people also think about their future health estimates. And so for many people who do not have a stable therapy, sickle cell disease can be progressive, meaning that the disease gets more severe as they go throughout their life. And so one participant, Chris, who ended up getting a half-match transplant, he said that I had to put, a lot of stuff on hold in my life. And I feel like this protocol, this opportunity just, it'll give me a chance for a better life. And so he's recognizing that even though pursuing a transplant trial took a significant amount of time of his present life, he was willing to trade that for hopefully more time in the future. Another person, Roy, however, said that because his health was currently stable, he wasn't willing to risk potential clinical instability in the event that he faced a transplant complication. He said, "But if it's something like life-altering for the rest of my life, I feel like I'm managing it so well now, I'd rather just stick with it." And finally, Fran, an individual who declined to participate in a curative trial, recognized that her ultimate goal was to live sickle cell free. She said, "And yes, of course, the holy grail, which is to live sickle cell free, was kind of at the end, but it's not sickle cell free. You don't just become a normal person." And so she felt like the potential future outcomes of transplant even though they could be positive, like being sickle cell free, for her, that didn't really match her understanding of what it meant to become a normal person. And so now I want to switch over to some of the social considerations that people weigh as they're making the decision to pursue curative therapy. And so the first is those functional considerations, which are, again, going to school, work, hanging out with your friends and family. So Kelly is the parent of a young child who participated in a stem cell transplant trial. And functional elements were very important for Kelly and her family. And she said this about her son. She said by the time he was in his 9th year, he was missing, I don't know, half the days of school he was at home. We were getting better and better with managing his pain. So he wasn't hospitalized a lot, but he was in pain a lot. Charles, again, this is the individual who undergoes chronic transfusions. He gets these every 6 weeks. And so that means that he goes to his outpatient clinic for a transfusion that takes roughly 2 to 3 hours. And earlier I mentioned that he said that it was stable, but he is acknowledging here that, and he says, so even though it's 1 day of every 6 weeks, people don't have to worry about that, where they get to enjoy their full 6 weeks. And so he's acknowledging that even though chronic apheresis transfusions have helped him have a stable life, that he can achieve all the things that he wants, it does still take some time out of his day every 6 weeks. And so each individual is going to have to weigh what different functional elements of their life they're willing to sacrifice as they make the decision to pursue one therapy over another. And so Kelly's child received his transplant during the pandemic when K-12 schools were primarily virtual. On the other hand, Charles has had this routine of apheresis for over 20 years, which has allowed him to get accustomed to it. He recently started his first full-time job after college, and so taking time off of his new career to pursue a curative therapy would be a major functional consideration for him.
Can I let you know we're beyond the window, so
yes.
can you wrap it up with this slide, please?
Yeah, I definitely can. Absolutely. So the last thing, and this is actually probably the best part to end it on, are the healthcare encounters that I talked about earlier. And so a lot of people talked about how their treatment and their fear of treatment, negative treatment, would help them make the decision whether or not to pursue a curative therapy. And so I'll read this quote from Kelly. I have the long form of it, but that's good because you'll get everything and we can end there. But essentially, Kelly really feared that her child would have to encounter these negative clinical encounters as he got older. And so she said, people talk about being shunned, people talk about being discriminated against, people talk about not getting pain medication because they are mistakenly looked at as junkies, and all the other challenges that come with it. I mean, there's societal, physical, mental challenges. So being able to spare him from that was everything. And so that was echoed by some other participants who were making their decision whether or not to pursue curative therapies. And the last thing that I'll say about this as it relates to pursuing the decision, because I think Kelly's experience was really, and her child's was really wonderful. Kelly, or informative of this, so Kelly did end up pursuing a curative transplant for her child, but she did so only after she felt like the transplant complications would be less. So they were really worried about the level of chemotherapy, but they were hopeful that with technological advances that would reduce. And so they decided to wait. And a couple years later, they found a trial that had reduced levels of chemotherapy. And so altogether, that all of these different contexts were what helped her make her decision. So on that, I'll end there. Thank you.